Thank you for being here. Thank you for organizers, Eric Neuville from Marathon Health, Nancy Miller from 1 and 5, Josh from USI. We appreciate you being here. Thank you for all the speakers you will hear today. And I will pass the baton to Nancy, who will start our conversation. Thank you.
Thank you, Victor. I want to introduce myself. I'm Nancy Eigelmiller, and I am the Executive Director of 1 and 5. We are a local nonprofit that works to put mental health education programs into area schools. We work with about 85 schools in Cincinnati, and we work with the 3 populations in the school: the students, the staff, and the parents. This topic is obviously very important to the work that we do. Today, we're going to talk about the behavioral health equity for employees. We're going to address the impact of psychological distress on employees, the common concerns, solutions, and best practices will be discussed by our panelists. Now I'm going to ask the panelists to introduce themselves. You're going to have to use your imagination because we don't have the camera right now. So hopefully in a couple minutes we will. And so I'm going to just start here in front of me to the right, to the left, and go across.
Good morning. Thank you, Nancy. My name is Patty Banks, and I'm a supervisor with Trade Health EAP, or an employee assistance program. And we serve not only Trade Health, but about 200 companies, both locally and nationally. I've spent sound.
Okay, let me put it back on.
When Nancy muted, it seems like.
Right. We're headquartered in Indianapolis and 12 employees.
Good morning. I'm Greg Harmeyer, CEO and co-founder of Tier 1 Performance. We are a strategy activation consulting firm based here in Cincinnati. We have about 280 employees. We work with large organizations on anything around their people. And about 6 years ago, we took it upon ourselves to start investing in developing mental health awareness and programs for our own employees, wondering if we could make a difference in their lives and in the lives of other companies. And it's been quite a journey for us. We'll share more of what we've been able to do along the way. It's of course been really timely these past couple of years as this topic has really, I think, raised awareness for all of us. So I'm happy to be here today. Thank you.
Good morning, Charles Taylor of Lyra Health, joining you. Lyra Health is based in Burlingame, California. I'm based out of Houston, Texas. Lyra Health is here to deliver access and quality in behavioral mental health, and do so in a way that is equitable and reaches employee populations. We pride ourselves in being able to allow someone to connect to care same day and be triaged to the right type of care in about 7 minutes. So glad to join you. Ready for the discussion.
And hi, I'm Charles Roberts with Compass Point Counseling Services and Practice Resources Network. Compass Point is an Ohio-based clinical private practice of about 100 clinicians, and Practice Resources Network is a software solution as well as some administrative support for private practices.
Thank you, everyone, for introducing themselves. So let's just talk a little bit about why this topic is so relevant right now. We are currently in an unprecedented time. As a society, we've seen a pandemic. It is a renewed and then a rising of radical injustice, turbulent election season, climate change, And as many of these, all of these issues have collided together on many facets of our life coming together. We've seen a very large increase in anxiety and depression. According to data from the Kaiser Family Foundation, 36% of adults report symptoms of anxiety and depression in June of 2020, compared to just 11% in June of 19. From an employer standpoint, mental health challenges can impact the retention, productivity, job performance, not to mention healthcare cost. As we move forward in 2021, forward-thinking workplaces recognize the benefits of investing in the mental health and wellness of their employees. We are going to spend the next hour discussing where local businesses are on this topic. So we're going to start off, and we're going to have the employers that are on the panel talk first, and they're going to talk about their company, their concerns with behavioral health equity at their company, and the solutions they're used today to plan on and into the future.
I'll go ahead and start. As I mentioned, I work at Marathon Health, and we are healthcare providers. We have around 850 clinicians that work for us. And in the last 2 years, as with every organization, it's been incredibly challenging. This year, we've seen an increase of 36% in our EAP claims related to mental stress and anxiety. And we've also seen a huge uptick in leaves of absence as people need to step away from the workplace. It's not only on the clinician side of the house, but also on the business side of the house as well. We're finding that we call our employees ambassadors, and we find if our ambassadors reach out to our EAP, they're often having to wait weeks before they're able to see a clinician. The great thing about being a healthcare provider is we do have behavioral health care available for our clients, for their employees. But unfortunately, right now, based upon a certain concern that our ambassadors have about seeing fellow employees for behavioral health, we haven't seen a large increase in them accessing that level of service. To try and help with that, Marathon Health is kicking off a brand new healthcare product called Anywhere, which is a virtual care product that we're going to be rolling out to all of our ambassadors starting in October. And the hope is that this will give our ambassadors a greater sense of security and talking with someone that, while affiliated with Marathon Health, may not be viewed as maybe the employee or the person that I'm sitting right next to. So hopefully being able to address a lot of that. We can continue to see a great amount of stress trying to hire individuals into behavioral health positions. It's very, very difficult, especially since the pandemic, since so many of them have returned to or are remote right now. And if we're trying to get behavioral health individuals into health centers, it's very difficult because many of them want to work remote based upon the concerns that they have with COVID. So right now there's a lot of challenges looking at trying to figure out better solutions to be able to provide services that we need to our ambassadors while at the same time supporting our behavioral health care counselors.
Thank you. And Greg?
Sure. So as I mentioned, our company's Tier 1 performance. And about 6 years ago, we started pouring into the space of mental health and mental health awareness, really wanting to make a difference in that field, not knowing what it meant. And in talking to the Linder Center of Hope here in Cincinnati about how we might be able to help with that cause, they suggested we work on companies because that's what we do for a living. And because they said there's just too much a shortage of resources. There just aren't enough resources for companies to know how to support their employees. And so we started working on ourselves. We thought that would be the best place to start. And we created a program called Start the Conversation. And I'll come back to that. But fast forward 6 years, I think we sit here today, like everyone, where 280 employees have generally been distributed working from home for the better part of the past year and a half. We've allowed our offices to reopen, but everybody's dealing with the same heightened anxiety and angst around them for all the reasons Nancy mentioned. I think it's been compounded by being alone. And so the isolation people have of working by themselves and the lack of physical connectivity or the limited physical connectivity, I think has taken an increasing toll. And so we've actually continued to see it get worse this year in the various data, VAP calls and support. We allow people to take unpaid leave on top of all of our benefits, and we've had 7 people take it for various mental health reasons this year. We've had we have a full-time coach inside our organization to support people on all kinds of fronts. She's probably supporting 30 to 40 people. So you get the people who are clinically diagnosed with something, which is always a significant percentage. But you also have, I think the data I saw, 60% of people show some types of symptoms of mental health challenges. So they may not be clinically diagnosed, but so we're trying to support all of them as well. We've tried to create structures to help people work through all these things. But I think this Start the Conversation program we started 6 years ago, which we relaunched last year, has been really instrumental, because what it did for us was it helped us normalize discussion around mental health. And it's a month-long program that we created. We redid it this year, but it has partner discussions in it. It has text-based opt-in for information. It's online resources. It has video testimonials from people telling their stories. And it's a sequence of various activities. But the biggest thing it did for us 5 years ago, 6 years ago, and again last year, was helped normalize this conversation about mental health across our organization. And we did research data. We did surveys before and after both times. Various things like 65% said they had a conversation with someone about mental health that they never had before. 19% said they encouraged a loved one to get support because of this program. 11% said they took action themselves in getting support because of this program. But the biggest thing I think it did was help people realize, like, everybody is dealing with this. Everyone around them, everyone in our company, everyone in their family, everyone knows someone struggling with some kind of mental health issue and challenge. And normalizing and destigmatizing that, I think, is one of the critical things. Now, I think this past year and a half has helped with that, frankly. I think it has really actually helped people realize, wow, this is everywhere. But it's still a big deal. I think 80% of employees in one survey we saw, or one research report we saw, are hesitant to get help because of the stigma associated with mental illness. And it takes 11 years from the time a person first starts showing signs of mental illness before they actually first seek treatment. So those are issues that have got to be dealt with. And that's really where we focus our attention, is how can we help people recognize, like, this is just a part of life and you've got to deal with it as it comes forward.
Thanks, Greg. So now we're going to move on to the solution providers, and they're going to talk a little bit about the perspective on the issue, solutions and results of their solutions. I don't know who wants to start. I'm going to start here.
Thank you. So again, I'm Patty Banks. I'm with Tri Health EAP. We've done a number of things over the past year. I concur with a panelist that we certainly have seen an enormous increase in people reaching out. It was kind of interesting when the pandemic first hit, everybody sort of hunkered down and didn't really reach out, and things got very quiet. I think that's sort of what happened. And then as it went on, I think it just increased in the stress of what that dynamic was. People sort of went into the pandemic thinking, okay, we can kind of shut down for a short amount of time and then we'll be able to reopen and go back to normal. And as that didn't happen, things really got more difficult for folks. I think when people went remote, that was helpful. And then as people started to ease back and get pulled back into the workplace and out of the workplace, and trying to balance that school and kids and all of the different things that were happening, it just created more and more challenges. And so we've definitely seen that uptick and that increase on people utilizing and reaching out for service. Just as an example, Tri Health itself, so as I mentioned, we serve about 200 other companies, but Tri Health generally has a utilization rate of 8% or so. The national average of EAP utilization is 5%. In the last couple of quarters, we've seen anywhere between 10 and 11% utilization. For a company of 14,000 people, that's a significant increase in utilization. And that's a good thing. That's what we want to have happen. That's why we're here. We're trying to support people. So we've been active in trying to get the word out in a number of different ways within our own company and within the companies that we serve. We did a number of different trainings that we offered for free, things on resilience, positive psychology, emotional intelligence, self-care, all of those things trying to promote different ways and encourage people to take care of themselves and recognize their own mental health issues, as well as, supporting their family and the people that were around them. It also reminded people about the EAP service and how they could access it, and trying to encourage them to utilize that service. We put together a stress management toolkit, which was a whole plethora of information with our workplace fitness team and our EAP team that allowed us to have a number of many different information about anxiety, depression, different types of self-care, physical fitness, how nutrition impacts our mental health, really just about anything that we could think of that would be helpful in supporting people and making it easy, go-to, grab-and-go information. And so we put that out not only again for our own team, but for other employers, and allowed them to distribute that to their company. So we've really tried to actively promote, encourage, and support the utilization of EAP, and try to increase that access as well. That's one of the things that I love about EAP, is that we really work at trying to increase that access, make it easy for people to reach out. Somehow it feels less stigmatized than reaching out or calling a professional counselor, even though it is all professional counselors. It's just another benefit that employees have. And so we try to really promote that and encourage people to access that service and make it easy for them to do that. So we have a number of different ways that people get connected. We work with private practitioners, plus our own clinicians that provide that service. And when telehealth really came on board, it had been there, but it really boomed and blossomed in a very positive way. I think I don't think we'll ever go back to not having that that service, because it just makes it much more easy for people to get connected and for them to feel like they're able to access it. So even if they have kids at home, if they have difficulty driving, it's all there and they're able to get it. So those are a number of the different things that we've done as part of Try Health EAP to support folks.
Thank you.
Thank you.
Charles number one.
So we'll recognize solution provider. So pre-COVID, we walked into the circumstance where you simply had to on to a platform, dial into a number, so that they could see clearly those issues. Then you have this massive growth that increases the demand and services. And the magnitude of the spirit of what folks are coming in. So you see a huge increase in people who are indicating to us that all these things exist, and now.
But you're going to have to unmute that one first.
You also change.
You have to unmute him first, or you're going to bounce off one.
Your desire is to try to serve. And so for us, we kind of find ourselves. We have people to a platform very quickly from a technology perspective. We get them into the right type of care. Do they just need some resilience training? Do they just need coaching, or do they need therapy? Right? Do they need medication management integrated with physician support? So that was our cornerstone, and we built from that point. We said, okay, well, let's say if they need therapy and we have to go face to face, they have to have that option, right? Some folks need that care, but we've also got virtual. Then we enter a world where virtual is basically the only option, right, for several months, and that's where we are. So we have right now, no matter where a person is in the United States, they are 20 miles or less from a Lyra provider they can meet face to face. We manage our network from a capacity standpoint. So as we grow and we add members to a certain zip code, we make sure that we have enough providers in that zip code to serve those needs from a face-to-face standpoint. And then we have the backstop of always being able to provide virtual care. So you've got a technology platform, 7 minutes. Someone says they need coaching, we connect them with a coach same day, usually about 7 minutes. They need therapy, they make an appointment. It's either later that day or the next morning, at least it's possible, right? So now we've dealt with access, but we also use evidence-based care to deal with quality, to make sure that they're not going to end up perpetual care. They're not going to end up sitting on the couch for the next 2 years, okay? For stress and anxiety, it's about 6 to 8 sessions. Depression gets up to about 12, right? And if they're dealing with substance abuse issues, you do get to kind of the 20-session model. So what we did is we created a program where we integrated with health plans so that when they utilize the number of sessions through our EAP portion, they're able to then transition to the health plan and get that continued support. And we're enhancing our substance abuse platform because that's one of the other things that's come out of COVID is we realized that it's a very real thing. And I'll be honest, I personally can acknowledge that I used to only buy alcohol for my Christmas party that I had at my house for my family. That's the only time of the year I'd go and purchase alcohol. And that would last me the rest of the year for the occasional drink. And a few months into the pandemic, when they came out with order alcohol, I found myself logging in and ordering alcohol. And I thought, okay, this is an issue. This is real for me. This has never been a part of my life. And it is. And so the organization, though, knows that there's a lot of folks out there that are dealing with it. And it's not the, okay, I'm done with my Zoom for the day, drink. There's some folks out there who are really diving in and going deeper. And so we've created a program to meet those needs and to connect with facilities so that if folks need to go into facilities beyond our typical outpatient care, we're able to deliver that. And it's all about options. It's all about being able to say, okay, this person, this individual who comes in, who seeks care, needs X, Y, and Z, and then being able to deliver it to them quickly, efficiently, in a way that they're comfortable with, because we exist in a place where what portion of the society is vaccinated? And then what's their attitude now that they're vaccinated? I got my 2 shots and I felt like I don't need a mask anymore. I can hug people again and I'm okay. Not everybody's there. Not everybody's comfortable, right? And when we were having this discussion earlier, but it's very real. And so when people are seeking care, you've got to address all those concerns. Are they vaccinated, not vaccinated? How do they feel about it? Do they want to be in person? Do they want virtual? Wherever they come in, whatever their needs are, and wherever they are diagnosed from the platform, we're going to meet their needs. We're going to get them the care they need and make sure they get enough care to recover. We have an 83% rate of clinical recovery in outcomes for people who are clinically diagnosed. And those returns come in less than 10 sessions typically with our evidence-based providers. So the results are there and we're trying to deliver it, and we're growing, expanding so that we can continue to bring on companies and deliver that care. I want to share this. Several years ago, and I mentioned this to someone earlier, my son needed care and it took me 62 days to get in front of a provider. Those are many nights of my wife and I crying and my son being in need of us wanting help, needing help, having reached out for help, but not being able to actually get him in front of someone. And now, fast forward to now me being with Lyra, and obviously Lyrians have access to Lyra's health. And so my son had an issue recently, and his mom is now, we were divorced, she's remarried. And so I go over and I go into his room and I take my laptop, we go into the platform, and she just started to boil some water to make macaroni and cheese. Like the quick way, right? Before the water started to boil, I had set an appointment for him. He was ready to go. He saw the face of the providers. And as he was trying to decide on which one, he said, well, Dad, I prefer to speak to an African-American. I was able to click one button and connect him there. And he then had options of people of color. Then he said he wanted a male. Okay, he's a teenager, he's 13. He's coming into some of these issues. I picked up the phone and I was able to get him connected to a male. But the interesting thing is, not too long after that, I get home and my wife, who's born in Monterrey, Mexico, decides that she had no idea I was going to my son. She wanted to enter into care. and her native tongue is Spanish. And she was able to go through the platform and get connected to a Spanish-speaking provider in just the same 7 minutes. And so my son is going to go face-to-face every other Saturday. She's doing virtual with a Spanish-speaking provider, but she has the option because that person's only 4 miles away. That's what this is about. Okay, their needs, their problems are being addressed. They were willing to take that huge step of reaching out for help, but we're able to get them the help they need in the most comfortable format possible. It was like ordering at McDonald's. I mean, I was even impressed, right? Because you talk about a platform, you're like, oh, it can do this, it can connect you to a provider. And I remember that 62-day experience. I remember what that was like. But then to go through and like, oh, you want someone African American? It's like, oh, you want a gentleman? Okay, didn't see any gentlemen. Let's call them up. Man, done. That's where care reaches that next level. I'm very proud to be a part of an organization that's able to do that. Now, we don't have every problem solved, right? We don't have, a magic wand we can wave over and make everything okay. But we're going to make every step we can, one at a time, in a thoughtful, clinically appropriate manner to deliver the best care possible. Thank you.
I'm also Charles. I am with Compass Point Counseling Services and Practice Resources Network. Compass Point is a frontline provider for mental health services here in Cincinnati and all over the state of Ohio. Practice Resources Network is a software and clinical management company. And the software that they provide actually does a lot of the same things that Charles was just referring to, matching up providers very quickly. You can get into a teletherapy appointment in under an hour with our providers. The side of this conversation that we haven't really talked about yet, but I think is also important, is that the mental health care providers themselves are struggling with a lot of the same things. And there's been a lot of talk publicly about how we're heading towards a mental health crisis. I think there's two sides to the mental health crisis. There's the supply side and there's the demand side. We know that the demand is increasing. And I think there's a variety of different factors that have caused that. I think there's the increased stress for sure that has caused increased demand. There's also the destigmatization, which has resulted in some people who already needed some help now finally being willing to reach out and get some help. And so some of the clients that I've seen have been struggling for a long time, but they've just now decided that it's okay and acceptable within their family systems for them to go and get help. So one of the concerns that we've been trying to manage as a private practice is, as we have this rapid increase in demand for our services, the supply of services available, the number of hours that our clinicians can actually provide, has been decreasing because they've had to compensate in their own lives for increased care of their family members, for changes in their circumstance, for kids now being at home. And it's also been blurring the lines for clinicians with teletherapy, as it has for most people who are out there in the workforce who've been working from home for the last year. If you've seen some of the studies on work productivity, surprisingly, work productivity has gone up for a lot of companies through this pandemic. That's because, for whatever reason, people are going home and they're working from home, and now they're working in times when they wouldn't otherwise work. And so they're actually doing more work and they're spending more time doing this. And so we initially saw that with our providers, where they switched from in-office to teletherapy when everything shut down in March of last year. And there were suddenly a whole lot more available appointments because they took their drive time, they took every free minute to try and help. But over the course of the last year, they've been paring that down and gradually scaling that down. And so that's one of the concerns that we've been watching very carefully at our practice. How do we provide for our providers so that they don't get as burned out? How do we reinforce the idea of self-care for them? And we've implemented some strategies inside of our practice where we've got sort of a tiered support system, where we've got clinical pods, clinical teams, supervisors, all kinds of different clinical meetings that they can go to try and connect with each other. But again, a lot of that is remote. And when you add the remote factor in, you're adding all kinds of technology problems. Just look at some of the problems we've experienced this morning, right? That just adds even more stress to what we're already doing, what we're already experiencing. So that's something I think we need to certainly be aware of as we're going forward.
So thank you, all the panelists. I know we're probably going to have an echo here, but the next thing we want to do is we want to open it up to the audience to see if you have any questions. And then also we want to find out what your best practices are and the solutions that you're using at your organizations right now that is helping with this situation. If you want to put your questions into the chat, we will pass those on to the panelists.
Who would like to start?
What
do you see as over the next 12 months, now that you've seen what has happened with behavioral health, et cetera, what do you see as your biggest challenge, number one? And then number two, what is the solution that you think is going to suit that challenge? Because now we've experienced all of this, we understand what's going on. It's the question is, what's the solution from your perspective, each of you as employers as well as solution providers?
So we're not a solution provider. We're an employer who cares pretty deeply about this challenge. And I don't know that I know the solution, but there is something we've been talking a lot about lately. Like the return to what the new workforce will look like, I think, is a question everybody's dealing with. And some companies are saying we're going to stay distributed. Some is everybody's got to come back. I think most are trying to figure out what the balance is going to be. We're thinking a lot about the importance of connectivity in people's lives. So it's one thing to just allow people to stay at home. I don't know that that's a healthy thing. And even for people who believe that they want it, I think it has caused a lot of the deeper anxiety and loneliness and lack of community and lack of connectivity and lack of commitment to things and feeling of commitment to them that sometimes I think we don't even fully recognize. I'll speak for myself. Like everyone, I was working from home for a long time. The past 2 or 3 months, I've been in one of our offices, probably at least 4 days a week by choice. It has had a hugely positive effect on me, and much more so than I realized it would. And I just think that figuring out how to deal with that is going to be a really important thing. Just saying, well, we can work distributed, we can work from home, and so we'll continue to do it, I think will perpetuate a problem for a long time.
How did you sense when you got back in the office? Is there better teaming? Is there it is great to be back in an office when you can, but not everyone can. So what was that? Tell me about that.
Well, I think there's probably multiple levels to it, and I'm not sure I have all the best answers. There's a practical level of the serendipitous connectivity that happens and collaboration that happens. And I think that's a positive benefit for an organization to have that happen. Just the creativity and the conversations and the insights that come from just running into people and running into conversations. But a much deeper level, I just think there's something about the energy that people bring to each other by physically being present with each other that I don't know the science behind it, to be honest, but I think it's there. I really do. And I think it's missing for most people, particularly as it pertains to their work environment. And we may be getting out in our own lives, but from a work standpoint, I think we need some degree of that. And one of the things we're going to wrestle with and try to figure out is how do you ensure we create that in our culture without mandating it? We're not an organization that mandates a whole lot of things to begin with. So, but we just believe it's an important part of our culture, and it's an important part of a healthy organization is to be physically connected with each other.
There are different parts of the brain that actually respond to physical human contact rather than contact via social media or a screen like this. And so that's where the balance between teletherapy and the in-person, everybody when teletherapy first happened was like, yes, this is fantastic. We can just sit at home in our comfy chairs and have our Afghans and do our teletherapy and drink our tea in our own environment with our pet, therapy animals. And that's good for a lot of things, but there are some clients that just doesn't work for. And even the providers, I mean, you were talking about the ancillary contact, hey, I got a free hour here. Let's go grab some lunch. That doesn't happen when you're at home. I mean, nobody's like, hey, looking up other people. I got a free hour. Let's do a Zoom lunch. And let's eat while we're on the computer with each other.
There are a lot of providers that actually will say that the act of getting up, getting dressed, and going to therapy is a fundamental piece in a part of that process and helping people get through it. So absolutely speak to that. It's very real.
Yeah, the other thing, at the very beginning of COVID, my team, there's about 50 of us, we would have Friday afternoon happy hours, and then we would have Tuesday team lunches. 6 months into that, they're like, can we stop this? We're really bored. We're really tired of it. And at first everyone was thrilled to get on, and then we actually had mandatory cameras on meetings and a variety of things throughout COVID. Well, within the last 3-4 months, we've actually started connecting in the office, and we do it on a quarterly basis, and we have an event, and it's optional, and we do it either over lunch, because we find if you have food and prizes, it tends to bring people together. And we're finding that it's helping individuals be able to balance kind of what we've talked about, that mindful connectivity that you really, really, really need. And as with most things, when it comes to the workplace, pendulum swings both directions. And right now, I think we're seeing it where everyone was really excited to go home and be able to work in their fuzzy slippers and their PJs. And now it's coming back the opposite direction. And I think it's really important that companies embrace that. And to your earlier comment, not that we mandate everyone has to be in every Tuesday from 8 to 5, but we provide those opportunities for people to come together in an environment that either we're masked or we're unmasked, whatever it is that we need to do to bring people together. And I think we've started doing those. And in between, we've been doing some connectivity events where we're mailing things to all of our employees, 1,200 of them. 2 months ago, I sent out $5 gift cards for McDonald's, and it was National Ice Cream Month. It connected everyone in the organization, and we have employees that are located in 42 states. But just for a period of time, people were taking pictures of themselves, going to McDonald's, getting their ice cream. It connected us. We're in the process of doing the same thing with fall Starbucks, because it is pumpkin latte season and everyone enjoys that. But that connectivity, even for folks that are remote in the middle of Kearney, Nebraska, that may only have 2 other people that work within a 6-mile radius, it connects them back to the overall organization. And I think companies have to be very, very intentional about ensuring those levels of connectivity, even though maybe you're still, situated in your bedrooms, your basements, and your home offices.
Each of you just real quickly before you speak, just reintroduce yourself. Some of the introductions were on the video. If they could just reintroduce yourself.
No problem. My name is Debbie Rout. I work for Marathon Health. We are a wellness and primary care provider that does our care via on-site and near-site. We have 1,200 ambassadors, as we call our employees, located in 42 states around the United States.
Any other questions here? We have another question back here.
Good morning. I'm Josh Martin with USI Insurance Services. My question for the panel is related to the children, youth, adolescent mental health. Charles, I know you shared a personal example. But a lot of times when an employee is dealing with issues with their children, it's almost can be more impactful than an issue with themselves. I'm curious from the employer standpoint, but also from the provider standpoint. What are you seeing? How are you enabling employees to deal with that from an employer standpoint? Or what's the solution, or what are the complicating factors for the youth?
Well, both stories that I have that are personally connected, both tie back to my son. Absolutely, in the journey of care, if I would have been seeking care for myself in that first example, I would have just given up and walked away and done with it. But you don't give up when it's your kids. Doesn't matter how long, what it takes, what you've got to overcome. We've seen a lot more folks in the last year come into our platform. And in every state, of course, the laws are a little different. So some folks have to be accompanied if they're under certain ages. But a lot of folks are coming in for their children. And a lot of folks that are coming in for themselves are discussing their children. And so there's some family care and some group care that we provide. And that's very, very, very important. But those needs being met really changes a person's attitude about their employer. When they go through a plan, I think most people, and this is just opinion, I think most people feel like their employer has a relationship with them, where I work for you, so you provide mental health care and health care and these plans. But when something happens for your child, you go, that wasn't a part of the equation, so thank you very much. Like I personally feel so much different. And I love this company. I was motivated by this mission as to why I joined. But the moment that my son got that appointment through Lyra, and it was exactly what he wanted, like he was ordering a hamburger, it was done. Like, don't worry, you won't see a resignation from me. I logged in, I was camera on for more things for a week. It's just real to me, and it does matter. And we're enhancing as an organization the outreach that we're doing to employees to make sure that they know, because again, as with any benefit, there first has to be an awareness that that benefit exists and that it extends to the entire family. For example, as an EAP, it goes to everyone in the household, right? And so, but you have to emphasize that, because most employees don't know that. A lot of people work at a place 10 years and had no idea that there was an EAP. And so you've got to make that awareness. And so we've made an effort there, and we've seen an increase of the 10.5% engagement that results in therapy. 50% of it since school started has been about kids.
It's an interesting thing that occurs with teenagers and adolescents and children when it comes to technology. As we've moved into this more teletherapy, less in-person kind of realm, certainly the need has increased, and that's true for adolescents and children, especially because they're in a completely different environment, don't really understand what's going on all the time. But the teletherapy providing means of service for these individuals is very different. And there's some different constraints and concerns that providers have about things like confidentiality, and whereas they're typically able to engage in person with young children and use manipulatives and games and things that are interactive, when you've got them on a screen, I mean, they're gone, they're off screen, and you don't know what they're doing, you don't know what's going on. And so at the same time, to get back to sort of the economics of supply demand, the demand's going up. More and more providers are restricting the number of kids that they're willing to see, adolescents that they're willing to see, at least via the teletherapy, because of some of these concerns, because it's just not as effective to try and keep it. And so it's this really awful give and take right now.
I would just add a few things as it comes to children. You know, one of the complexities, I think that was part of the question, is if you have employees, well, even if you don't, but certainly if you have employees distributed in various states, various school districts, you have just a lot of different unique experiences in terms of how they're dealing with all this, how their schools are dealing with it, how they personally feel about how to handle, you know, masks, unmasked, in school, out of school, all these kinds of things, how much they're open to being in a workplace or around other people. So stating the obvious, but I think attending to the individualism and the flexibility that's required right now, I don't know that can last forever, but for now, I think it's still very real, and providing the space for people to feel okay with figuring out the way for them to manage it, I think is really important. The other thing, and this is beyond COVID, and kind of going back to the Start the Conversation program we did, helping people understand where to go and how to even start helping themselves, but helping their children. That has actually been a far bigger thing for us, is the program. And by the way, our Start the Conversation program is freely available. 14 other companies have taken it and launched it. We give it away. But the whole intention of it is to raise awareness and understanding of what you're looking at and how you can get started to get help. And I've talked to more people who didn't know where to begin, people in our company who didn't know where to begin. Like, they see signs of things, but like, who do I talk to? And is this real? Is this something I should be concerned about? And we dealt with it in our family. I felt fortunate because I've learned a lot over the past several years and knew how to deal with it. But I know so many people don't know where to start, and helping create a community and connectivity where you have other people to talk to who are dealt with certain other similar things and have options of where to go, I think is a huge thing employers can do, is to just educate and support and encourage them to know where to just go get support for their kids. So.
I actually have a question.
I'm going to answer this question myself, because being in the school districts, historically we're doing education in the schools with parents and with staff. And what we found over the last year and a half is that the parents are really absent. They don't show up for any education. They're just so overwhelmed with their own life that they can't make it into any kind of education that's happening at the school. So as an organization, one of the things that we do is we have relationships corporately out in the community with organizations, with corporations that support us. And so we consider all of those people to be our sponsors. And we went to all of them just recently and we said, you're supporting us. Now we want to support you. We want to provide this education in your organization, like Mental Health 101. What is that? What are we looking at? What are the signs and symptoms? What are the resources? How do you have this conversation? And a lot of corporations, like Greg said, they're not doing that work. And it's amazing that once you get in there and you start raising that awareness, the amount of people that start to say, this is a problem for me. And I didn't know what to do. I don't know what the resources are. And thank you for doing this. And so I encourage anyone out there, any corporation out there, to make this a priority. Make it something that you're talking about on an ongoing basis. You're educating your staff. You're telling them about the EAP. You're like at schools, even with schools, we say, put the EAP information front and center, because if you talk to the staff in schools, none of them know about it. And so they don't feel supported. And so make it front and center, make it on your website, put it out there. So you're raising that awareness across the board. Yeah.
I had one last question. I know we were running a little late. My question is about a comment you made informally in previous conversations about how the workplace, the company, contributes to the mental health or the lack thereof, to the distress of the employee, and the culture of the company as it reflects employees' mental health. I wonder if you could comment on that briefly.
Well, I would start by saying I think the research is very clear that it does. Jeffrey Pfeffer out of Stanford wrote a book called Dying for a Paycheck, and they did a lot of research correlation between health causes of all sorts and how the workplace affected them. And his conclusion was the workplace is one of the leading killers in America because of the association of higher stress, heart conditions, suicide, all kinds of things that are derived from stress created in the work environment. So this I think sobering understanding of like we create a lot of the challenge through the work is a beginning point. How do you alleviate that? I mean, I think creating support resources is part of it. Trying to create a culture that that prioritizes organizational health and trust amongst people, and recognizes that part of our job as employers is to create healthy lives for people. We serve the people that work for us. And having that lens, I think, is a critical part versus how do you drive higher productivity? I think your point earlier, like productivity is way up. There's no question about that. But if our sole purpose is simply higher productivity and higher financial gain, we've got real issues. And so thinking about like, how do we create a balanced work environment and what does that look like? Part of it absolutely is creating wellness programs and creating health programs, but so much of it is just mindset, like understanding that we own that we own an environment that creates a healthy life for the people that work here. And we can't just abdicate or deflect that or take a mindset like that's their personal problem. We have to have a healthy environment to start with. So I think a mindset's a beginning.
The other thing that I would add to it, one of the things that I think is probably one of the most positive things that's come out of COVID is companies really assessing the work environment and the fact that they now have much more flexibility, and they're, embracing the fact that their ambassadors, their employees can work from home. And to your earlier point, it does increase productivity to the point. But at the same time, you've got to ensure that the culture of your organization supports everything that we've talked about today. The mental health, the overall physical and mental well-being. And employees are looking for that. I think it's starting now. And in the past, to your point earlier, people were looking for a paycheck and they were going to work for anyone. But now people are going to be much more choosy. They're going to be looking at culture, purpose, and those type of things. And that's, for me, I think one of the positive things that's come out of COVID, because people are stepping back, they're assessing their personal work situations, and they're making choices. Now, on the other hand, it's led to the year of the Great Resignation, and from an employer standpoint, constantly looking for great people. But in the end, the organizations that have the best cultures, that embrace things like mental health for their employees, that look at not only the employer, but their entire family, those are the employers that have to go win out. And that's, like I said, one of the positive things that's come out of this. Employers are really looking finally at things that they probably should have been looking at for years.
Two other comments I'd like to add. One of the most damaging things I think organizations do is layoffs and reductions. Unfortunately, we're not in that mode right now, but we were a year and a half ago where someone was doing it. And I don't think anybody does it flippantly, but I also don't think organizations fully think through the consequences on the well-being of those who are laid off and their families, or on the people left behind. And it is an enormously stressful thing for a culture to know that that might even happen. I also think how we handle underperforming people is a huge part of a culture of both for that individual and the stress of, like, if I'm not doing my job, what that does for them and their family, and what it says to other people around them of how do we treat people? Are they just a transactional thing that if they're performing, they get to stay? If they don't, we discard them. Those mindsets, I think, have a big effect on the overall well-being of a culture and the trust that exists.
We are winding down to the end here. I want to thank all the panelists for being here today and for everyone for joining us today. I think this was a great conversation. I hope that everybody views this as the start of the conversation, and that you make it a priority at your organization, that you're talking about mental health, you're talking about mental wellness, and you're putting the resources into place to help your employees. I don't know, Victor, I know that you want to wrap it up here and talk about the next panel that we're going to have.
Thank you so much. I can't think of a more valuable conversation to have these days. I appreciate all the panelists. I appreciate the organizers. Thank you so much for being here. Thank you for all you who joined us today and the first day of fall. And sorry for little lapses in technology. They made us all stressed out. So we appreciate you being here. Our next event is on November 16th, and we will be advertising shortly. Please join us at Xavier University, the Center of Population Health. Thank you.
So thank you, everyone. Thank you. Thank you.